Donald Trump has opened the new year with deny, deny, deny when it comes to his many health concerns. This by way of an exclusive interview by the Wall Street Journal on the topic. But the internet has snapped back with liar, liar, baggy pants on fire, and I have all the burning and trending details for you next. I'm Dan, and welcome to another Occupy Democrats report. To get all of our daily doses on Trump's war on everything and his battle to remain upright, please hit that subscribe button. The Journal's interview with the liar-in-chief is titled, "As Signs of Aging Emerge, Trump Responds with Defiance." In an interview, the president says he has eschewed some advice from his doctors and regrets getting advanced imaging. Here's some highlights I've curated, along with some of the most brilliant responses that the skeptical internet has to offer. They say aspirin is good for thinning out the blood, and I don't want thick blood pouring through my heart, Trump 79 said of why he takes a larger dose. I want nice, thin blood pouring through my heart. Does that make sense? They'd rather have me take the smaller one, Trump added. I take the larger one, but I've done it for years, and what it does do is it causes bruising. And to that point, CNN offered this analysis.
Let's discuss now with Dr. Jonathan Reiner, professor of medicine and surgery at George Washington University. He's also a CNN medical analyst. Doctor, really appreciate your time. Just last month, you said you were seriously concerned about the president's health. What's your level of concern after hearing from the president, who says he's in perfect health?
Well, I'm mostly concerned that the public really hasn't been told essentially anything meaningful about the president's health here. So let's turn the clock back and look what's gone on over the last 9 months. The president had a physical exam, a comprehensive physical exam in April at Walter Reed. And, they listed a bunch of studies, which were essentially all normal. The president was great. And there was nothing else to see. Over the summer, the president developed really greatly swollen ankles, which prompted another series of tests. They called that chronic venous insufficiency, despite the fact that just a few months earlier during his comprehensive exam, the president's physician said he had no swelling of the leg. So it doesn't sound so chronic to me. It sounds more acute. And then something happened in the fall. Something happened in October that prompted an off-cycle series of tests by the president's medical team. And when the results of those were released to the public, they used some basically euphemisms to describe what the president, the test the president went through. And the euphemism was advanced imaging. And they didn't describe whether it was a CT or an MR. And then later on, a few days later on Air Force One, the president basically said he had an MRI. He couldn't describe what body part, but he said he had an MRI, which prompted the president's physician again to release another statement, at which time he again did not describe the specific test the president underwent, and said that, again, everything looked fine. And now we learn that the president didn't have an MRI. He actually had a CT scan, which explains why the president's physician didn't describe the test after the president disclosed his MRI, because he didn't have an MRI. And in his statement to the Wall Street Journal, the president's physician, Dr. Sean Barbabella, basically said the test looked great. There was no abnormality, which actually doesn't correlate with what Dr. Ronnie Jackson told the public in 2018 when he disclosed that the president had a similar CT scan that showed the presence of coronary calcium, which is a marker of coronary artery disease. So I'm almost less concerned about the actual cause of the president's bruising. We can talk about that than I am about why the White House medical team has felt the need to study him in the last few months. What symptoms, what clinical concerns have prompted this? Because the president is right. When you test the president of the United States, it creates a lot of concern, and rightfully so.
Journalist Aaron Rupart broke down the article with these nuggets. Oh my goodness, this Wall Street Journal piece about Trump's ailing health that includes an interview with him. There are a number of ridiculous details in it, and I'll put a few of them in this thread. The piece doesn't directly address what's going on with Trump's black hand, but says he has delicate skin that causes him to bleed constantly. Trump said he applies makeup to his hands after he gets whacked again by someone. He added, I have makeup that's, easy to put on, takes about 10 seconds. Trump denies what we've all seen with our own eyes, that he regularly falls asleep during on-camera events, instead saying he's just blinking. Sometimes they'll take a picture of me blinking, and they'll catch me with the blink. Finally, Trump's diet. Oh my God. The piece closes with RNC Chair Joe Gruters saying he was shocked to witness Trump eat French fries, A McDonald's quarter-pounder hamburger, a Big Mac, and a Filet-O-Fish in one sitting. In sum, despite all the obvious lying, if this piece is meant to dispel concerns about Trump's health, it actually does the opposite. This is not a guy who is taking care of himself at 79 years old. Ex-user Chili Dog had this reaction. Trump is a sick, fat, slob, dementia-ridden moron, and the fact the dude actually sat with the WSJ to try and explain it all away is goddamn hilarious. When has a president ever had to give a full interview on his health to the WSJ? Where are all the MAGA Trump Superman memes? I'll close by offering my diagnosis about the Wizard of Ott. He doesn't have a brain, at least not the one he used to cleverly con more than 50% of the voters. He doesn't have a heart, and the cruelty he often displays proves that. And he doesn't have the courage to tell the truth, not about important issues facing our country, and on this day, not about his declining health.